Hello, good evening, and welcome to Cafdil Healthcare on Cafdil Television. We are coming to you live from Cape Coast, 4th Reach. If you want to know our location, when you come to Cape Coast, try and visit 4th Reach. That is where we are. We are also live on Facebook and also on YouTube. Tonight, we are going to discuss what we call vicarious trauma. Most of the times, it affects all of us because some people may watch television and begin to cry. They go through so many things. Based on what they see, what they read, they traumatize based on that. And tonight, that is exactly what we're going to discuss. My name is Kojo Arthur. My guests are seated already, and I will introduce them when we come from this short break. Stay tuned.
Since time immemorial, God has always communicated himself and his will through various voices, the prophets, the kings, the judges, not forgetting John the Baptist, who was a precursor to Jesus Christ and gave us the will of God. We bring to you Voices from the Valley. This is a program designed by the Conventual Franciscan Friars in Ghana in collaboration with Cafdil TV to bring you in-depth insight in our faith, catechesis, and various Catholic teachings which will help you in your journey as a pilgrim. I know you cannot miss this program, and I highly encourage you that you shouldn't miss this program because it is Voices of God from the Valley of Prayer and Silence. Join us this and every Sunday at 3 p.m. and a repeat on Wednesday at 7:30 p.m. here on Cafdil TV and on our various social media platforms, YouTube, Cafdil EDU, and Facebook, Cafdil Cape Coast. Let us meet and share what God has for us through the Voices from the Valley.
Lord, make me a means of your peace.
Welcome back. If you just joined us, this is Cafdil Healthcare on Cafdil Television. My name is Kojo Arthur, and tonight, like I said, we are discussing vicarious trauma. We're going to know what vicarious trauma is about and signs and symptoms. If you are suffering from that, or if you are traumatized, what will actually show, or for someone to know that indeed you are going through those trauma. I have with me Francis Akwamensa. He is clinical health psychologist intern at Cape Coast Teaching Hospital. You are welcome, sir.
Thank you, sir.
Good. And Dave Davis, a known face. Yeah, he's a health educator, right? From Cape Coast Teaching Hospital. You are welcome.
Thank you.
And also Favor Ajibola Ben. Yes, clinical health psychologist, Cape Coast Teaching Hospital. New face, old face. You are welcome.
Thank you. Thank you very much.
Ladies first, eh? Or this one, yeah, it doesn't matter. No ladies first.
Oh, anything goes.
Anything goes.
Yeah.
Oh, okay. But then let me start from Dave Davis. From old face, then we come to the new face. Dave, trauma. We've heard trauma. Vicarious. The English is too big for some of us, actually. So you tell us what exactly it is and how is it different from ordinary stress or burnout?
Okay. So first of all, I'd like to say thank you for this opportunity. We are always in a hurry to share what we know in a form of helping the public to be able to understand a few things that they do not know. And then today, thankfully, our topic is vicarious trauma. So when we say vicarious trauma, another word we can use for it is secondary trauma. Usually when we say something is secondary, what does it mean? It means it's opposite or next to the main thing that is over there. So there is a primary thing and then there is a secondary thing. So the vicarious trauma is secondary to the primary thing that is happening. This can happen in so many ways, and by hearing, by seeing, and all those things. But talking about vicarious trauma itself, it's a psychological or cognitive distress that we go through. Usually when we see someone going through trauma, or we hear someone just went through a specific trauma or something, someone will say, oh, is this thing important at all? Yes, it's important. Why is it important? It's important because vicarious trauma on here is it can happen to anyone. It doesn't have any specific thing that it affects, or maybe you'll say only this set of people are the ones who get affected by vicarious trauma, or this. It happens to everyone. That is why we've decided to speak about this topic today. So looking at stress and then burnout. Stress is just something that usually happens when there is work overload. So it's more like what you are doing, there's a whole lot of stuff that you are supposed to do. You are supposed to beat the time, you are supposed to do this. So it's like the workload is a lot for you to handle at that particular time. So your response to that particular situation is the stress. And then burnout is when the stress becomes extreme. That's where you tend to enter the burnout. So considering the three, and then to summarize everything, vicarious trauma is usually a secondary trauma. It's a cognitive or psychological distress that we go through whenever we see something traumatic. And stress is a response that happens when there is work overload. And then the burnout has to do with when the stress becomes too much. So in this case, we can say stress pro max. So when the stress is too much, that's where we have the burnout also.
I said vicarious. You are using vicarious. So which is which? You got
tomato. It depends on where you are coming and then how you want to mention it.
I'm from US. You are from UK. All right. So thank you. So Favor.
Yeah.
Who is most at risk of experiencing vicarious trauma?
Okay. So as he said, trauma doesn't discriminate. Depending on, there are some people who have specific risk factors who are very much at risk to vicarious traumas. We have, especially in the professional field, we have the doctors, the nurses, the dialysis staff. They see a lot of trauma, oncology, cancer patients, cancer staff, and then staff at the OBGYN, the obstetrics and gynecology units. You see, they see mothers who have just given birth, mothers who have lost their babies, mothers whose babies couldn't make it to full term. So mostly healthcare professionals, even psychologists, ourselves, we are also liable to experience vicarious trauma. Yeah.
But so can Francis, can an ordinary person like me, like my colleagues, Favor made mention of especially health workers.
Okay.
Those of us who are not health workers, can we also, or counselors?
Okay.
Can we also experience this trauma?
Okay, so as my sister rightly said, anyone can actually experience it. Anyone at all. The market women, the ordinary worker, journalists. Your work right now that you are doing, you meet a lot of people who have gone through traumatic experiences like rape, like domestic violence. So your constant repetition of exposure to those kind of traumatic experiences actually brings vicarious trauma. Yeah.
Yeah. So with vicarious trauma too, with the work, he made mention of the work you're doing. We have journalists. We have and we are mostly almost always on social media these days, doom scrolling and all that. And some of these things, we see them, war, reports of wars, violence here and there. And this is not exclusive to a set of people only. Almost everyone is on social media these days. And so, yes, the ordinary people also get exposed to some of these traumatic events, and that can definitely lead to vicarious trauma.
So when you were exposed to and you don't care about what, how then do you experience? Some take it as a fun.
It's true.
All the time.
When it gets to that point, then you know that the person is experiencing it. That is a sign of a person experiencing vicarious trauma. You see, when you've gone through, you've seen it for so long, you become apathetic to it, to the point where, oh, mehusa, I've seen it. Oh, someone is being raped, someone is being shot, they are murdering someone, they are pulling someone out of an accident. If you become exposed to it too much and it becomes as if it is normal, then you know that the person is experiencing vicarious trauma, because they become cynical. Even when they see someone in real life, not on social media, they see someone experiencing something, then they go back as if what just happened is not something serious. Then you know that, okay, this person is experiencing vicarious trauma.
So doctors have seen death. Those areas, that department that you mentioned, they've seen death, they've seen people. Now let me take you to the signs, because you have brought in those signs. Apart from what you have said, what other sign will indicate that indeed this person is experiencing this trauma?
Okay, so they may become emotionally numb, as if they may start treating patients or clients like numbers or bedside. So bedside number this, bedside number that, have you taken care of? They wouldn't even bother to learn the patient's name or get to know the person, because they don't want to form any form of emotional bond or attachment to the person, because they've seen it over and over and over again. That is one of the signs. And it can also go the extreme, to the point where it's like they feel overwhelmed. They start avoiding patients. They don't want to talk to patients. They don't want to deal with patients, because they are afraid of forming that emotional attachment to them.
Is it against the ethics?
I wouldn't say it's against ethics, because as a doctor, you need to form a bond with your clients, with your patients, in order to be able to give empathetic care to them. Now, when it gets to the point where you've seen it for so long and you become apathetic to it, it affects the quality of care you are able to give them. So it's not necessarily against ethics, but then the patient-doctor relationship suffers as a result, and the quality of care the doctor is able to give the patient end up being reduced. Yeah.
But coming back to the ordinary person like me, who don't see this often, and when I see it on social media, I say, oh, this one there, this one there. Don't you think it's because I don't use my heart? I don't use I don't put myself in the person's shoe too much. That's why it does not even affect me. And when you see me like that, can you say that it's also a sign of
vicarious trauma?
Yes.
Okay, so I would say we all have different level of cognitive resilience, different level of threshold. So individual differences, it boils down to it. What could be traumatic to you may not be traumatic to me. What I will see and I'll be like, okay, I can move on from this. You will see it and you completely break down. So I like the fact that you said perhaps you are not often exposed to it, and the one time you are exposed to it, your brain thinks that, okay, I can handle it. I've seen it, but then it's not going to break me. It's not really going to affect me. Someone else will see the same thing and, oh, emotional breakdown. It becomes too much for the person to handle. So it's vicarious trauma also differs from individual to individual. Yeah.
Because I've seen a lot of people watching movie, and when they see that kind of treatment, I mean, they begin to cry. Yeah. When anything, they begin to cry. Does this also show that they are suffering from the vicarious or vicarious trauma?
Oh, so it could actually be a form of defense mechanism. Maybe this person is trying to push out everything that they are seeing. So in a form, they are trying to act like, oh, I've not seen this, so I don't know what is going on. But I believe, even after watching, as a tiny drop or a small bit of information is actually stored in your head. So the more it keeps piling up, you may not notice. Usually, maybe you may not notice that. Then people around you will actually start seeing the signs and symptoms around you. It's actually something very serious. I can use myself as an example. So I remember the first time that I went to work at the hospital, and then I went for normal ward rounds with our boss at the surgical ward and all that, and we got there. We were actually seeing a client, and I don't know why, but I just started wandering around. I was just looking around, and they were actually doing a process on a patient, and then my eye just got there, and immediately I saw it. I just had to turn my head, but I couldn't get a picture out of my head. I got to the house, and guess what? They were pounding fufu with meat. Guess what? I could not eat it because the image just kept crossing my head and all those things. So, yeah, sometimes you may see it and then you may be like, oh, this one there is nothing. But whatever you do, as you've seen it, a little bit of information about that whole scenario will be kept in your head. And it's actually going to depend on how you may decide to process it or anything. And that's where maybe the defense mechanism will come in. Some people actually try to push whatever that will come into their, they try to push it away, and then, but it will still affect you one way or the other.
So, Francis, Dave said it's very serious, something serious. So, then how can, or how does repeated, exposure to other people's pain and suffering actually affect the mind and emotions?
Well, it's you see, vicarious trauma actually is when you keep on exposing or repeated exposure to other people's trauma. Yeah, so when you keep on exposing yourself to other people's trauma, it can affect your emotions, it can affect your thoughts, it can even affect your overall relationship with others. Yeah.
Dave, this thing that you talk that you couldn't get it off head, is it different from addiction? I'm asking this because we have a movie series that I know some people, they cannot do away with a day, all because of what is going on or something of that sort.
Okay.
Are they addicted, or because of what they see, they are traumatized and they want to see the end and put themselves in whatever is happening?
I'm trying to get the question. There we go.
What I'm saying is,
okay,
maybe I know some people, they cannot get away with a movie, a particular movie, a series that, a profit series that they have been watching.
Okay.
Just because maybe there's kind of ayakayakazi going on. You understand? So my ayakayakazi going on. Somebody is doing something untoward towards a friend or something, and they want to know the end. And you see them, like I said, you see them crying, you see them emotionally distressed and stuff. Is this one of the signs and symptoms of this vicarious trauma?
Oh, okay.
Are
so
they traumatized?
So we are trying to find. You are trying to find the difference between addiction and then the vicarious trauma. Oh, okay. So looking at the addiction, usually addiction has to do with a kind of theory where there is as a instant gratification of pleasure or something. So usually when people are addicted to something, they are sort of getting some kind of instant reward whenever they are doing that particular thing, and then a whole lot of brain chemistry and things come in, but we'll not go to that side. So yes, when there's addiction, usually it means that person is getting some form of happiness, that person is getting some form of, the person is looking for something, and then it's like they are getting it the moment they use that particular thing or the moment they do that particular thing. So you may sometimes even realize maybe someone drinks alcohol or something. You could see that the thing is affecting this person's life, but then they are not really bothered about it. Why? Because usually when they drink the alcohol, they get some kind of feeling that no one knows. Only them they are the only ones who understand whatever they go through, and then sometimes they have all these feelings and things. So so that has to do with the addiction side. But then with the vicarious trauma, you are just going through trauma. Usually it's mostly because what's the fancy word, like a humobo.
Empathy.
So they have this empathy thing, like they want to be in the person's shoes, like they feel that person's pain, they are sad.
Them emotionally.
Exactly. And then that's how they are.
So it's good you brought. You said somebody who drinks alcohol, even though it is affecting him, but he cannot stop.
Exactly.
The same thing applies to this one.
And the thing is, with the vicarious trauma, considering alcohol and then vicarious trauma, there is a bit of difference, because usually with the vicarious trauma, in some cases you can do away with what is happening. So let me give you an example, like a nurse who has to work a night shift and then the shift is over. Instead of you going to the house, you see maybe you'll be sitting down chatting with your friends, doing all these things, and then you just be there, and then a new case will come, an accident and all that. Will you be able to just sit down and not do anything? Obviously you are going to
work again,
do it again. And then taking social media also, for instance, you know, these are our algorithms and all these things, they pick up what we usually watch. So the moment you start watching, maybe there is a funny Ejako movie, you skip it. There's maybe a music, lyrics, something, you just skip it. But it gets to a place where they are showing maybe an accident, a funeral or something, and then you keep long over there, you keep watching the thing. The algorithm will just start packing it for you. So we just start following. So something like this, you know, you can do away with it. Just try not to get yourself so involved with the phone where you start to watch all these things. When it comes, you can just skip it. When it comes, you can just skip it. But then usually with the vicarious trauma, we rather try to put ourselves inside, because we want to understand and feel the pain or the sorrow or sadness that the person may be going through at that particular moment.
Can it affect our physical and mental health?
Oh yeah, vicarious trauma actually affects us in so many ways. Physically, you may start losing sleep and all those things. So taking, for instance, you are trying to get a bit of sleep, and then you have these flashbacks of all the things that happened. Obviously, you'll not be able to sleep. You start having nightmares, you'll be sleeping this sleep disorders and all those things, insomnia. You'll not be able to eat, you'll be having. So physically, you see that you may even start losing weight. You may start not taking care of yourself and all those things. So small time, you see the person complaining about headache because they are not getting enough rest. They are not getting enough food. They are not taking care of themselves very well. So obviously, when you look at them physically, you see that there is a problem over there. Cognitively, too, you see it's even difficult for them to solve simple things that they were able to solve at first, because now they cannot even sit down for a minute or two to think about everything that is going on. 1 + 1, you see the person's mind is somewhere else, cry. They cannot solve things that they were doing at a particular time. So problem solving and all those things become a little bit complex for them. And then looking at behaviorally, which is what they usually do around themselves, you see this person will not be able to get the enough attention and then things to be able to do the simple work that they used to do around themselves. They may even try to withdraw themselves away from the other people. And here's a case where even anxiety and all these things can set in, because imagine you always see accidents or some traumatic experiences on your phone and all those things, and then let's say you are traveling to Accra. The moment you hear the horn of a car, you just become alert, like, hey, there's something happening, there's something happening. So yeah,
kind of crowd talk that man, then we begin to ask questions.
Oh no, Jesus said, so yeah, you will not even be able to live your normal life. You are always on the flight mode. It seems you're about to run and fight and all those things. So yeah, those are some of the ways that it can even affect us.
Is there a difference between mental health and mental well-being?
Mental health
and mental health well-being, sorry.
I think mental health is just the general form of whole thing, and then the mental, it's a bit similar. It's a little bit similar. Yeah.
Okay.
Yeah,
What are the similarities?
The similarity is usually they both have to do with our mental how we process everything, how we keep, how we do our things very well, especially when it comes to cognitive reasoning and all those other things. So just keeping yourself healthy.
Yeah. Okay. I was asking, going to ask a question about the accident that you made mention of, social media and stuff.
Okay.
How does this trauma affect the mental well-being?
Okay. Okay. So yeah, looking at all these things, as human beings, we usually think a lot about whatever happens, and then we have some people who are naturally overthinkers. So when something happens, usually they tend to think so much about everything that happened. And then just like we said, an accident has happened. This person is always alert. This person always thinks something is about to happen. So they are even unable to go on with their normal daily life, because as a Israel, the slightest thing they are alert and all this. So maybe small things that they used to do to even make themselves happy, they can now not do it again. So every time you meet them, they are either hidden at a particular spot, trying to hide away from the whole world, because they feel maybe the world is trying to attack them or something. So yeah, vicarious trauma can actually affect our mental well-being when it comes to
Favor. I'm actually the board. I say, do you know when you do my what it means is that when you are there in person, it's different from your picture, seeing your picture. I want to know whether watching traumatic events online, repeatedly, have the same emotional impact as witnessing them in person.
Okay. So trauma in and of itself, it can be experienced in three major ways. First, when you go through the traumatic experience yourself. Second, when you see or you witness the traumatic experience or event. And the third is when you hear like graphic, you hear graphic detailed accounts of the traumatic event. Now, vicarious trauma is experienced through the last two. That is what you see and what you hear. And both is being done through social media. When you are online, you both see what is going on, and perhaps there is someone giving a detailed, gory account of what is going on. So yes, you could watch something, maybe a 2-minute, 3-minute video of a gory accident, go about your life, but then the thing keeps ringing in your mind. Hey, this accident, and the scene, I don't know, those who capture it, they make sure to get the details, so you will see everything. And he mentioned algorithm. Once you've watched it, you keep on scrolling, and more of those kind of things is being brought to you. You can become hyper vigilant from that, as he said. Wherever you go, even people around you, and I say, Besio, you're careful. Say. You any slight thing, you become hyper vigilant, that you think that, oh, something bad is going to happen. Your world view can change. How you see people, how you see things, how you view morality, how you even view God. Your spirituality can change. If there is a God, why is it that all these bad things keep happening? So yes, going online, doom scrolling, seeing traumatic things online can really affect your mental health.
I know it can affect, but I want to know, like, okay, you hearing that someone is dead is different from seeing or the person dying in front of you. Are the impact the same? That's what I want to know.
Yeah, the impact is not really the same. But then hearing that someone is dead too, it also depends on the relationship between you and that person. If I hear that my sister is dead, right, obviously I'm going to fall apart. The relationship is very close, and saying it too, it increases the effects, because obviously seeing someone go through something like that, seeing an accident happen right in front of you, the brain has a way of capturing those events, capturing that thing, to the point where when you go, as I said, you may not be able to sleep well because you keep getting flashbacks of the things that happen. So yes, somehow seeing can have much more effect than hearing. But with the hearing too, it has to do with the level of details that you are giving about the event.
Oh, okay. All right. We will go for a break, but I want you to tell us current prevalence research of this trauma.
Okay, so vicarious trauma, because as I said, the professionals, they are more exposed to it. Almost every day they are exposed to it, so they are more likely to develop vicarious trauma. I think about 21 to 75% of healthcare workers, emergency responders, first responders like the police, the paramedics, they are always on site whenever these kind of traumatic events happen. So they are more likely to experience vicarious trauma.
So about 75%?
Yes, 21 to 75%.
Wow. Oh, okay.
Yeah.
So we have vicarious trauma.
And when you also become, when you get scared, you are in your room, you are watching a horror movie, you get scared. You are also going through vicarious fear.
Oh, so the vicarious are...
So we need to be very, very careful. You need to be very careful when you are defining these concepts. Yeah. So you will not be allowed to take care of your brother or your family member. Yes, because taking care of them, you might have affection for them, and it might even, you know,
I don't know how it's going to affect your work when you know very well that my mother is sick, is at the hospital bed or on the hospital bed, whatever. I am not there.
But someone
is taking care of.
That is why you need to.
That thinking isn't also not affecting me when I'm also taking care of someone.
That's why you have set healthy boundaries for yourself.
You will still think about
that. Is how to. That's why you set healthy boundaries.
So it's not like you will not think about it. When situations like that happen, you'll be in the right to, dwell on it or think on it. But then sometimes there are some decisions that will need to be made, or some steps that will need to be taken, and you may end up making those steps out of your emotion. Perhaps there is an objective way to handle something, but because you want because
she's your mother
to be well, you want her to, that in itself is not bad, but you may end up going to the extreme. You may end up doing things that you ordinarily wouldn't do. Okay. Because it is your relative on the line.
Taking care of the person anyway.
Because medically, doctors have to. I think there are some drugs that doctors have to steady you for some time. Your body, your brain, everyone has his own way of responding to some medications. So if I'm a doctor and I'm taking care of my mother, because I want my mother to heal faster, I might, overdo something, then it's kind of so that's why you have to set healthy boundaries, to protect yourself.
Does it have, Dave, does it have any long-term effect?
The vicarious trauma. Oh yes, just like any other thing, if let's say the problem is there and then you don't solve it, it keeps getting worse and worse and worse. It's almost like if there's a tap over there and then a sink which is blocked, you open it, it's full, you do not close it, what happens? It becomes a lot and then fills the whole place. So yeah, that's why even in healthcare, usually the term they use, you are supposed to be very careful, and then early detection is very, very important whenever there is a problem. So the moment there's an early detection, you try and then you do what? Work on that particular thing. So yeah, vicarious trauma, just like any other thing, if not taken care of or if not taken serious, can lead to more serious things. Because I believe as we were speaking, we said a little on the signs and symptoms, and we mentioned some of the physical ones being headache and all these things. Imagine having a headache for 365 days. What do you think will happen to you? Exactly. so yeah, it means everything will start getting worse, and then you could even develop a new medical condition and all these things. Yeah.
So if let me add up to what Dave said. You see, people take care of their physical well-being. They take care of themselves, they eat good food, they take in proper medication, but they forget their mental health also, which is very are very, very important. So awareness and then self-care. So it's important. Yeah.
So you made mention of we don't have a medicine per se, but we need to protect ourselves. So
you set healthy boundaries. That's the first one. Set healthy boundaries in the sense that I'm a doctor, I'm a psychologist, I'm a professional. So whatever amount of traumatic experience or information that you are giving me, I should be able to contain and handle it more professionally. I believe you are getting it. I shouldn't be able to get so emotional or too emotional. I should be able to handle it professionally. I should make up my mind that no, I'm a professional, so I should be able to handle whatever I'm getting professionally. Then you can also reduce or avoid certain distressing content. People are so much interested in, Facebook, TikTok, Instagram. There are so many distressing news coming day in and day out. For example, you even use the June 3rd disaster, for instance. Someone who witnessed or someone who even watched it on TV might even decide that no, I will not visit. Yes, I will not even visit a filling station again whilst it's raining, because something like that can happen. And then the helicopter disaster also, someone can even say that no, I will not even take helicopters again. I will not take them again, because of when I take them, I might,
but the accident is on air, on land, on sea.
So that's why you need to take grief from this distressing content that are so distressing. That can traumatize you. You need to take grief from it. And then you can also practice self-care. You can pray, you can exercise, you can listen to soft music. And good music that can even soothe and soothe your brain. Soft music. Music that are not so but very cool.
Example.
On your brain, and then the sounds. That's a music that are only instrumental.
All right. So, what healthy habits can help us, build emotional resilience? Because this thing we cannot avoid them. Favor.
Okay, so he made some very good examples. Music, I like listening to cools. Cools, they kind of settle you down after. Exactly. They put you in the moment. You can also exercise a lot. Exercise can release endorphins. They make you happy. They get rid of that bad energy. And then have a good sleep hygiene. When you are in the room, you are on the bed. That's not when you now start scrolling through TikTok and all that. At least 1 hour before your bedtime, you put your phone away.
Really?
Yes. Yeah. So, it doesn't help with proper melatonin development. Melatonin is what helps you. And I, for example, I can't function well without minimum 7 hours of sleep. So it's during sleep your body is able to process some of these things. Trauma, your body takes note of it. However, with vicarious trauma, he mentioned you are not able to sleep well, you become irritable, your mood and emotions are all over the place. Your body is affected by it. So if you're able to sleep well, your body is able to produce more melatonin, which is going to help you have good sleep. Okay. So sleep is one thing we have to prioritize if we want to remain healthy mentally.
So at what point, Dave, should our time is even drawing nearer. It's even up actually. At what point should someone seek professional help?
Oh, for me, I believe the moment you see it, try and then seek professional help. Okay. Because people go to school for what you maybe everything that you see with your eye or hear with your ears, people actually go to school for it. No matter what it is, people go to school for it. So whenever there's an issue and then someone is there who can help you very, 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 very well, the earlier the better, so that you won't wait till the thing gets very, very bad before you decide to do it. Take care of it. And you can also speak to that. The reason I didn't want to say you can speak to your friends and all those things You see, with professionals, usually they are bound by a lot of laws and all those things. So, for instance, seeing a therapist or a psychologist, for instance, there are laws. So, like the confidentiality and all these things, everything you say to your therapist stays between the two of you. Whatever may be traumatizing you stays between the two of you. But if you believe you have a trusting friend that you can also speak to, and then at the end of the day, they can help you come out of it, so you can also do that. But yeah.
So seeking help, yes, therapists and psychologists. These are the two.
Oh, for the professionals.
I mean, if you want to seek help.
If you want to seek help, that's what I was saying. The therapists are the ones I believe are the best. But then if you feel you have people around who can also help you to come out of all these things. And
we all live with families. This one just a minute.
Okay.
We live with families. So certainly we may need their support when we are going through such trauma. So what kind of support do you think family can give someone who is going through that trauma?
Okay, so in our society we have the Bemensu. I would like us to try as much as possible to get rid of that kind of thinking.
So the
Bemensu, exactly. So when someone is going through vicarious trauma, sometimes you may see symptoms that is similar to PTSD. That's post-traumatic stress disorder. So we should normalize conversations about vicarious trauma. And with families are made up of individuals. So if we have this kind of thinking where, oh, it's okay to be emotionally vulnerable, it's okay to express yourself, people will be free enough to open up about what they are going through. Sometimes the first step in healing is acknowledging that there's a problem. How would I acknowledge there's a problem when the society where I live in, they think you should always be tough, manly, don't show emotions and all that. So we need to normalize emotional expression in our society. We need to normalize it. So people should be free enough to express themselves.
All right, thank you very much. So any one advice, 1 minute?
So we should also promote, give room for open conversations about mental health, which is very, very important.
Right.
If you have a wife who is a nurse, or if you have a husband who is a doctor, or a policeman, or a journalist, or someone who you think that get these traumatic events and painful stories every day, when he or she comes home, you should be able to know that one way or the other, or he or she might go through trauma. So
okay, so as I said earlier, I would like us to be more open about expressing. And when we see someone who is going through this kind of symptoms or signs of vicarious trauma, we shouldn't be afraid to tell them that they should seek professional help. Seeking professional help doesn't mean they are weak. It means they are strong enough to know that they need help.
All right,
exactly.
Okay, so I would say vicarious trauma is actually something that is there. It's not being created or an illusion or anything. So, and then when you get into it, there are people around you who can help you. So always seek help when necessary. Yeah.
Okay. All right. This is where time will allow us to be with you. You heard Francis Aquamensa. He's a clinical psychologist intern, Cape Coast Teaching Hospital. Dave Legane, wherever.
Yes.
Ajibola Ben, clinical health psychologist. Somebody wanted to that or
oh, okay.
Because of the name. Yeah. Okay. All right. So thanks for watching. My name is Kojo. At the same time next week, good night.